But what I'm hearing more, and not just in my practice, but outside, is what we're all hearing, right? This noise, I like to call it, the noise of, should I be on a GLP-1? Should I be losing weight? Everybody else is. What does that mean for me and my sense of body and sense of self-worth?
Hi guys, and welcome back to Real the Expert series. Today we have a treat, a longtime friend. I am so lucky to have Dr. Rachel Goldman here. Dr. Rachel Goldman is a nationally recognized NYC-based psychologist. She's an author and a clinical assistant professor at NYU Grossman School of Medicine. She specializes in health behavior change, stress management, weight management, and CBT. And you also may have seen her on Oprah. She focuses on helping individuals build sustainable, healthy habits as detailed in her work and upcoming book, When Life Happens. I'm so excited for you guys to tune into this episode. It means so much to me, and I know you guys are going to resonate, so please enjoy. Guys, I am so excited today because I am here with Dr. Rachel Goldman. I've known you for like years now, I feel like, so
I know.
I'm very honored to have you.
Thank you. And I'm just so thrilled to be here with you today. I remember the first time we connected and then you hosted a panel that I was on. So I just feel like it's kind of full circle coming back together now. So
I know.
Thank you.
I know. With both of our projects launching at the same time, which we were just talking about, it's so exciting. And we're going to get into the book later, but I know you as being like the body image expert, especially in the age of like GLP-1s. You've talked so much. She's on Oprah, guys, like crazy flex. But talk about how you got started into like this realm and, you know, like going from just being a psychologist to kind of finding this like specialty.
Yeah. So actually what people probably don't realize is that this is how I started. So I went to graduate school specializing in behavioral medicine and really took an interest in the treatment of obesity for children. That was what my dissertation was on. And then for my clinical internship and fellowship, I specialized in bariatric surgery and the treatment of obesity. Wow. So straight from the beginning of getting my license, I actually worked at Bellevue Hospital in their bariatric surgery department. And then it was like a no-brainer. Like, here we are with new treatment options available for the treatment of obesity. Of course, I'm going to be talking about it.
Yeah.
And it was interesting because every time I was getting media questions about it, you know, they're like, what do you know about this? I was like, we've known this for years, but with patients who had bariatric surgery.
Right.
So it's really nothing new to us in the field. It's just making headlines now.
Yeah.
So I really, you know, again, it kind of was just like a natural progression of like, yeah, I'm helping individuals with body image and disordered eating and treating obesity with surgery. Of course, like, we've had medications out there forever. They just became more popular with the injections and with the GLP-1s.
Right. I mean, we have to get right into it because what we're seeing right now, as you said, like it's kind of like never before.
Yeah.
What are you seeing like in your own practice as far as people struggling with body image, people wanting to get on GLP-1s? What are you seeing?
Yeah. So again, it's kind of interesting because I've had the clients I've been working with for so many years. Actually, I'll have openings again soon. I have a long wait list, but you know, so most of my clients actually came to me years ago, either pre or post bariatric surgery, or maybe women in their 30s, you know, struggling with body image, relationship with food, eating, or their body. But what I'm hearing more, and not just in my practice, but outside, is what we're all hearing, right? This noise, I like to call it, the noise of, should I be on a GLP-1? Should I be losing weight? Everybody else is. What does that mean for me and my sense of body and sense of self-worth? And I think that's where it gets really tricky. And this conversation is so nuanced because of that, because these medications are medications indicated for individuals with chronic illness, and people that don't really need them and aren't qualified for them are using them at the same time.
Right. And with people that are going on them, young people that are going on them, how does that affect you mentally when you are using something? And obviously physically as well. But can you speak to like how it affects people mentally?
Yeah. So, I mean, first of all, I think to make it clear for people listening, if you don't have a chronic illness of obesity or diabetes, you are probably using the medication off-label and or compounded, which means it's not approved by the FDA. It's like a compounding pharmacy giving you a smaller dose, microdosing we keep hearing.
Right.
And there's no clinical trials on that yet. I mean, they're happening, but we don't have the research out there yet. So I think that's the first thing people need to understand, that if you are on this or you're seeing other people on it, it is not prescribed by a medical provider who is using it for that reason.
Interesting. I keep hearing people, I saw like another influencer post, I have food noise, so I went on a GLP-1. What, like, I mean, look, I don't know who's prescribing what. Yeah.
So like maybe that person is getting it from an obesity medicine specialist or from a prescriber that is giving them the FDA indicated actual medication that's out there and not compounded. I don't know.
But if it's someone that's at a normal weight and you'd have food noise and you're on a GLP-1, do you think that's like a Band-Aid? Like we're not solving the issue.
Yeah. So yes and no. It's funny because I recently said in another podcast that GLP-1s, I think, are like a diet for individuals who don't necessarily need them and are going on them to lose like 5-10 pounds.
Yeah.
Kind of like the wedding diet, right? Like, oh, I want to lose 10 pounds for this event. I'll go on a GLP-1. Then you're going to get off of it and you're probably going to regain the weight. Yeah. So that's a diet. My definition of a diet is anything that's not sustainable.
Yeah.
These medications aren't made for that. There's no long-term research on individuals going on them for a short time to lose weight, then getting off of them. I don't know what that's going to look like. But what I do know is that these medications do help with food noise.
Yeah.
So BMI aside, weight loss aside, body size, shape aside, my clients, their food noise is getting lower. I like to think of it as like the volume. Like it is definitely decreasing for sure. The medication is helping with that.
Yeah.
Is it safe for individuals at a normal body weight to be on these medications? I don't know. Right? The research has to come out.
There's no research
exactly.
on it.
But because it is so helpful to the individuals who need it and lowering the food noise so much, I would imagine that there is research going to come out with the smaller doses, with looking at, say, longevity, heart disease, food noise, et cetera.
Yeah.
Because they are really life-changing for the people who they're indicated for.
Right. So can you explain really quick, like who's a candidate?
Yeah. So currently GLP-1s are FDA approved and indicated for either individuals with obesity or diabetes.
Okay.
Both of those are chronic illnesses.
Right.
Obesity in particular is a chronic recurring illness.
Right. Okay.
Which means that you need treatment pretty much for the rest of your life.
Right.
May or may not be the medication, but I like to think of it as hypertension. Like if you are on a hypertensive medication, when you're on the medication, your blood pressure lowers. When you get off the medication, hopefully you're not going to get off the medication, your blood pressure is going to go back up. So you have to do something in order to maintain and manage that disease.
Interesting. So for someone that's just overweight, that's not
I mean, they may meet the criteria based off of several different factors. I mean, even looking at years ago with bariatric surgery, you had to have a certain BMI to initially qualify.
Right.
And then the guidelines have kind of expanded because we also know that individuals with obesity are at higher risk for other illnesses.
Right.
So like you could have a slightly smaller or lower BMI and have a comorbid condition, which is like diabetes, hypertension, high cholesterol, sleep apnea. I think I said all of them. But you could have like a lower BMI with one of those as well. So with GLP-1s, it's kind of the same. Like there's like a threshold. It's like, okay, you have this BMI.
Yeah.
I don't love that we use BMI, but it's the fact, it's like the measure that we're currently using.
Right.
And or a lower BMI with one of those health conditions. Something else we look at is like how long have you been struggling with your health, right? But I like to put the focus back on health, not just weight, right? So a lot of my clients that are on them struggled with their weight, struggled with their health for years. And they would do everything. I don't know your story, so I don't want to make any assumptions, but they would do, say, anything that the average person would do to try to lose weight, right? Like maybe eat a little less, move a little more, maybe even move even more, try to eat a little less, and their weight and their health wouldn't budge, right? Then they go on a GLP-1 and all of a sudden it's like, oh my God, I can do all those lifestyle changes and the behavior changes I've been doing and my health is improving. So that's where I really think it is life-changing for the individuals who need it. I've really found that it has given people hope who have lost hope.
So I wanted to share, I've never talked about this before online, but this August, I went on a GLP-1 it was crazy because I'm a person that has struggled with disordered eating my whole life. I went into my adulthood going off of a stimulant medication, and my hormones, I mean, I never was told this, but I've never dealt with weight gain in that way before.
Yeah.
And on top of that, I was on antidepressants, which make me function. And I wasn't going to stop any of that. But post-Adderall weight gain was crazy for me.
Yeah.
And I was trying everything and doing everything. And for the first time in my life, I had a healthy relationship with food. Like for the first time, I was like, I'm active. I'm eating like what I want to eat, but I'm eating healthy. And I felt great. And then on top of the inner criticism, the threads online saying that I'm overweight.
Oh. I'm sorry that you had that experience.
Yeah, I mean, it shouldn't affect a person, but I'm human and it does.
It does. We're human, exactly.
And to the point where this summer I was at a breaking point and I was like, I actually don't know what else to do. And it's like helping all of these people. Maybe I'll try it. I'm not going to talk about it because I'm not a success story yet or a non-success story. Like, let me actually just like see what happens.
So can we actually reframe that?
Yeah.
There's no success story or
It's
not
true.
success story. You know, it's like either the medication helped you or it didn't.
Yeah.
Right? And it's not you. Like, we even reframe that, right? Like, years ago, people used to say, like, oh, you failed bariatric surgery if you had weight recurrence. But no, the surgery failed you.
Yeah.
Right? So the medication doesn't work for everybody.
Right.
I have some clients that are, like, super responders and it's working great.
Yeah.
And I have some clients that, like, it's helping them maintain their weight.
Yeah.
They're not gaining, but they're not losing.
Yeah.
So it's really, you know, the question is if it's the right treatment option
Right.
for you.
Right.
Just like ADHD medication or depression medication or anxiety medication, there's a lot of options.
Yeah.
You have to find the one that works for whoever it is.
Right. And as a person, I was afraid of the risks because as a person who was technically overweight BMI-wise, but not obese and not suffering from any chronic conditions, it was a risky thing for me to go on it. But I did. I'm off of it now, but I just wanted to talk about the side effects because they can be gnarly.
I would love to hear about your experience with it, and then I'll share like what I know from my clients and everything.
I struggled with feeling like my personality was dulled, feeling like I'm very silly and goofy and outgoing, and I felt just everything was kind of taken down and dulled. I really didn't like that. Food noise went away for me, which was amazing, but at the same time, I really get enjoyment out of eating, and it kind of took a little bit of the fun out of it for me.
Okay.
And like that feeling of hunger I wasn't getting as much. I kind of felt like I had to force feed, especially because I was really trying to do it in a healthy way, making sure I was getting my protein in, like doing it the right way, not just not eating.
Sure.
And stomach issues, crazy
Like
stomach issues, nausea, diarrhea, unpredictable stomach issues. So, because I think there's a glamorous online presence about it, but it's not glamorous.
Well, I think it depends on a lot of factors, right? Everybody's an individual, and they're going to have, you know, your body is going to react to that medication in different ways. Exactly. Things that I've noticed also is depending on the prescribing physician, which exact medication you're on. Again, if it's compounded, completely different story because you don't really know what's in the medication, to be honest.
Right.
I've had clients on compounded and have horrible side effects, and then they go on the actual medication.
And they're fine.
They're fine.
Yeah.
There's also certain things that we can do, like because I've worked with so many clients on them that I know, like they're not tricks, but I call them tricks.
Yeah.
Like, you know, like, okay, you get nauseous. Let's make sure you're eating enough before, but not too much. Let's make sure you're staying hydrated. Let's make sure there's certain things you can tweak in your own lifestyle and behavior to kind of minimize some of those side effects. But again, it just depends on you, your body, and the healthcare professional that you're working with.
Right. Yeah.
But it's interesting, you know, I haven't heard a lot, at least in my clients, in terms of like the lower mood and the lack of interest in food. Because there is a difference between food noise and finding joy in things, right? It could be joy in food, joy in other things, which I know you spoke with a colleague of mine about anhedonia and depression.
Yeah.
But that's anhedonia. That's, you know, like not finding joy and pleasure in things you used to find joy in. But it's also not surprising when people do experience that because it's working on the same pathway in the brain that decreases kind of, you know, the reward center.
Right.
I mean, it's all related.
Right.
So there is some research that shows kind of, you know, some anhedonia and lack of joy, lack of food cravings,
Yeah.
which again is different than food noise in a way,
Right.
as well. But I'm sorry to hear that you
No,
had those experiences.
It's actually, I think, like a positive thing for me because I like live online and I live watching people get smaller, and I think it's sad to like have to experience it for yourself to know what's right for you or wrong for you.
Yeah.
But going forward, now I'm like more focused on like what else can we do? Like what other options are there?
Yeah.
Which is why I think it's so great that you're here with me. I would love to get into like emotional eating because you've had so many good nuggets of wisdom about this. I definitely have struggled with emotional eating when I'm happy, eating when I'm sad, eating when I'm bored. Why do we do that? Like, why is this an issue that so many of us face? And why is this, it's like the dirty little thing that all of us do.
Yeah. Well, it's interesting because as you're saying that, I was almost thinking like, and why do we even think it's a problem? Right?
Yeah.
Because so many of us do it.
Yeah.
Right? I actually don't think I've met anybody that hasn't participated in emotional eating at least once. Right?
Yeah.
I mean, I have.
Yeah.
You know? And it only becomes problematic when it causes distress.
Okay.
Right? If it's problematic to you, if you don't like it, if you feel out of control, then it becomes a concern. Right? But for instance, if I come home one day and I'm like, I had a stressful day, and I go grab whatever I grab and I eat it and I move on with my day, there's no problem with that.
Yeah.
So I was emotional and I ate.
Yeah.
No big deal. I often say it's the thought that follows the behavior that's more important than the behavior itself.
Okay.
So if you're going to eat, I don't know, what's your favorite thing to eat when you're stressed or sad or angry or anything?
Probably like froyo or ice cream or
Agreed, me too. So
or
good.
maybe like pretzels, like a little sweet and salty.
Okay. So say you have a rough day and you eat some froyo or ice cream. Now, the thought that you have right after you eat it is going to determine what happens next. So if you're like, oh, why did I do that? I feel so guilty. You might then start restricting.
Right.
Or you might, I don't know, like maybe somebody might purge or vomit or do something else.
Yeah.
And that's not going to make you feel good.
Right.
You know, so thoughts, emotions, and behaviors are all linked. The behavior is going to lead to a thought, leads to an emotion, leads to another behavior, so forth.
Right.
Now, if, like the example I gave before, I had a stressful day. What can I eat? I grab this. I eat it. I feel in control.
Right.
All right. Or even maybe I don't feel in control. And I'm like, you know what? It is what it is. I had a rough day. Move on with my day.
Yeah.
Totally different course of action. Right? Like, all right, I moved on.
Yeah.
So it's that thought that keeps us kind of stuck in this cycle.
Right.
Or helps us move forward. But so many people do it. And the way I like to describe it is the first time somebody participated in emotional eating probably had really nothing to do with the emotion, had more to do with like something became like an association. So like for instance, many people in the evening, maybe if you're a parent, maybe it's when the kids go to bed, maybe if you're sitting on the couch watching TV, you're going to grab ice cream, or maybe the first time it was like you had a stressful day so you want to go out, grab some froyo. Now all of a sudden you built an association. You're like, I'm eating ice cream at the end of the day. It's giving me comfort.
Yes.
And now it's an automatic behavior that has become a habit. Many people don't really realize it, that they're like grabbing something or maybe even not enjoying it when they're doing it until after the fact.
Right.
So really it's just about taking a pause and being like, what do I really want right now and why?
So you're saying like it's okay if you're not feeling that guilt after, there's nothing wrong with having, I mean, I eat a sweet treat every night.
Me too.
Every night.
Me too.
And some people would be like, that's like aggressive or like you shouldn't do that.
Do you enjoy it?
Yes. And it makes me so happy.
Me too. My husband every night, actually even my son, who's not so little anymore, but he's like, Mommy, when are you having your ice cream tonight?
Yeah,
I'm like, oh, pretty soon.
Yep.
Like it is coming.
Yeah.
And one day I think he was like, do you have ice cream every night? And I'm like, yes. And you know what? He does too now.
Yeah.
And it's like a little bit, he feel like we both feel in control. It doesn't matter. We enjoy it.
Yeah.
It's not a treat. That's also, I you know, we don't label things.
Yeah.
Like I think we want to take that out of the equation. It's like, you know, sometimes my son will be like, can I have a cookie? And I'm like, sure. Have it with dinner. Like you also don't need to necessarily finish dinner to have this. Let's just have it with it.
Yeah.
Right?
Yeah.
So, and it's fine. It's, you know, again, it's fine as long as it's not causing distress for you.
Right.
Or a problem for you. Like,
Yeah.
don't get me wrong. If you have like diabetes, maybe you need to be mindful of what you're eating, maybe low sugar, you know, things like that. You make it work for you. It can also be, I mean, sometimes my children don't have ice cream and they have like strawberries and Cool Whip or strawberries and whipped cream, you know, as their dessert, so to say, or after dinner snack. You could call it whatever. As long as you feel in control, you don't feel guilty about it. And it's not causing a problem for you. Like, for instance, if your medical doctor is like, look, we really got to cut back a little bit. I don't think we should eliminate anything from our diets, but we should be mindful of what we consume.
So how do we do that, especially from a person that I used to restrict when I was younger, and no matter what now, when I restrict, I find myself obsessing over food again and feeling out of control around food. Like I literally, it doesn't matter how much older I get and how much farther away from the problem every single time. And I think that's what drew me to a GLP-1 in the first place. Every single time I've tried to lose weight, I'm obsessed with food again. And all of a sudden, all the problems in my brain are flooding back. So it's like, what does someone like me do when I'm still trying to, I want to be healthy and I want to be happy, but like I want to feel in control. I don't want to become unhealthy, you know?
So what people don't realize is that we didn't have a term for food noise until GLP-1s, but we've had it. We've known the symptom of it forever. I actually spoke at a food noise symposium maybe even a year ago at this point, and it was great because we had eating disorder specialists, specialists in the treatment of obesity in the same room, and we literally were all talking about the same thing. And we were like, yeah, we've known this for years in individuals that restrict. The food noise gets louder with restriction because you are, in essence, starving your body. When it's almost like the elephant in the room, right? You're trying not to focus on it. So it's all you're going to focus on, and it's all your brain is going to tell you because your brain wants food. So we see food noise in individuals in all shapes, body, and size. It doesn't matter if you're in a larger body or in a smaller body. It, you know, some of it does stem from this food restriction, and some of it stems from individuals with obesity for other reasons as well. But we see it in both kind of areas. And I think the first thing we can do is not restrict, right? There's a difference between restricting and being mindful about what we're eating, right? Like I said before, no food group should be off limits unless you have an allergy, a sensitivity, or some kind of chronic illness that means that you need to limit it, right? Which can be complicated then. But really, it's about fueling our bodies for what they need and for joy. You know, I like to remind people that food isn't just fuel. There is a large part of food is in our society and culture and things that we do, and it brings us joy. And I don't want that to take that away from anybody. You know, like if you get pleasure out of eating certain things, eat it, but we have to feel in control. And when we feel out of control, that's where it gets really tricky. Because that's where then the cycle kind of starts, right? It can be the thoughts, the emotions, the behaviors, the binge, the restriction. It becomes this, like, I call it the disordered eating cycle.
It is. And I've struggled with it my entire life, and so many women I know have gone through the same thing, just in a little bit of a different form. But it's like, how do I tell my body, like, you're safe when it doesn't feel safe? Because my whole life, I'm 28, I stopped my disordered stuff. Like, I was a lot better since I was like 23 or 24, but my body still doesn't know that I'm safe, really. Like, if I ever feel like I need to lose weight, or even if I think about it, like the idea of it, I can feel myself start to get hungrier, start to focus on food more. So it's like, how do you tell yourself that you're safe? How do you talk to yourself? How do you handle food?
So first, for people listening and for you too, the reason of that is because your brain is used to it, right? Your brain and your body are always talking. There's signals being sent all the time, messages, the mind-body connection. But your body and your brain have known something for years, okay? Like, I don't know, let's just throw out a number. For how many years would you say that maybe you had some disordered eating thoughts or behaviors or combination of?
20-something.
Okay. And you said you're 28. Okay. So now let's think about, for how many years have you been in a healthier place?
Like 4, 5.
Okay. So that 20-some years of experience is stamped in your brain. So the teeniest little thing can trigger kind of those kind of almost like triggering in your brain, like, oh, here she goes again, right? All right, we got to go in, you know, like auto drive. Here we go. We know what to do. We're going to start restricting. We're going to start doing this. We're going to start doing that. And that's what your brain knows.
Yeah.
Our brains are wired for survival. It's also wired for familiarity. It loves comfort and what's familiar. So again, like the associations of like sitting on the couch watching TV and eating at night, that's an association. It's familiar.
Yeah.
So it takes time. I don't want to make it sound like poof, it can be gone. Yes, some medications can be helpful, but it takes work.
Yeah.
And it takes a lot of rewiring the brain, which is possible through self-talk, right? So just like things are learned, we can unlearn and relearn, which is kind of the premise to my book as well, like with the mindset shift.
Yeah.
But what I would recommend, not being your therapist, because I'm not, but what I would recommend is using that self-talk with a relaxation technique, actually.
Interesting.
Because if your body is calm and relaxed, and then you tell it something, it might trigger that like anxiety, fight or flight. And then you can bring the body back to the calm or the reset or the grounded place and kind of couple them is what I would say. Like almost couple the self-talk with the relaxation.
So like a meditation or something?
Oh yeah, or like a breathing exercise, any kind of grounding exercise that works for you. Like just talking through everything we're talking about, like I feel like that would be good if your brain is automatically kind of wired.
Yeah.
So what you're doing in that way is you're signaling to your brain like, nope, that's not what's going to happen right now. I'm going to stay calm. I'm going to stay in control. Now, what's important to remember is that there's no like the job, we don't want to like completely eliminate it, so to say, or rather our goal isn't to completely eliminate it.
Right.
Maybe it is, but it might not be realistic, right? So it's just like anxiety. The goal for many people isn't to just eliminate anxiety. The goal is to manage it,
right?
To live in it a little bit less, right? So like maybe you get a little anxious. Maybe you go into that thought process for a moment and then you catch it and you're like, oh, I'm not there anymore. That's not me anymore, right? That's the old phase of me. That's a different stage of my life. You know, whatever language resonates with you. But that reminder. And in cognitive behavior therapy, again, thoughts, emotions, behaviors are all linked. We can examine the evidence.
Yeah.
So if you have an unhelpful thought, I don't know, I'm going to put you on the spot for a minute.
Please do.
So what would be like an unhelpful thought in the moment that you're like starting to spiral or maybe going back to that unhealthy place?
I'd be like, oh, like I'm starving and I'm craving X, Y, and Z, and I feel like I want to eat a lot of it.
Okay. So if you have that thought, first, I would want you to pause and check in with yourself. Like, am I really starving?
Yeah.
Am I hungry?
Yeah.
What's the last thing I ate? Was it satisfying?
Right.
What do I need right now? Kind of some of those questions, like whichever ones resonate, I would ask. And then again, that pause though is everything.
Yeah.
Because that pause is the regrounding. The pause is the reset.
Yeah.
Because if we have the thought, I'm starving, I don't know what to do, blah, blah, blah. What are we going to do? We're going to impulsively grab the food, feel guilty, eat it, and then downward spiral.
Right.
But if we can be like, okay, I'm allowed to be hungry, but let me, for a moment, right? Like I always say, you never want to be starving.
Yes.
And you never want to be overly full that you don't feel well.
Right.
Right? So like there's a happy place in between that like it's time to eat and I feel a little hungry. Or I'm satisfied kind of thing. But kind of that check-in. And then you could be like, okay, you know what? Maybe I'm not starving, but maybe I didn't eat a very satisfying meal.
Right.
This is what I hear often.
I think it's a problem with a lot of people.
It is. I hear it all the time with my clients. They're like, but I ate this, and that. And they're like, but I ate grilled chicken and salad. I'm like,
that's not satisfying.
Yeah, that sounds really boring.
Yeah.
You know, I'm like, where's your, I don't know, things that I like. Or it's like putting goat cheese in it or avocado or almonds or pecans or, you know, I'm like, how can we make it more satisfying, right? Yeah. Just grilled chicken and vegetables is a little boring.
Yeah.
If you like it, go for it. Love it.
Go off.
Right. Like you can do it.
Go off.
But most of the time when I hear this from my clients that they're like, I'm starving or I don't feel satisfied, it's like because they ate something that they didn't really enjoy.
Yeah.
And I'm like, okay, maybe the thing isn't to just add more food necessarily. Or to just eat whatever's in sight, but let's make that really good, right? Let's make it satisfying. You don't want to lose that, right? And again, that's, to me, you think of a diet, you think of like steamed fish or grilled chicken and like vegetables, right?
Yeah.
Like add a little oomph to it.
Yeah, exactly.
And then what's probably going to happen is the food noise is going to quiet.
Right.
You're not going to be so hungry. You'll be, it's time to eat or I want a snack.
Yeah.
and you'll move on with your day.
Mm-hmm.
But we have to check in and be like, what did I eat? Was I actually satisfied?
Right.
Or am I stressed? Am I emotional? Am I sad? Am I bored? What else is going on?
Mm-hmm. So it's like asking yourself those questions too. And is that kind of what you're supposed to do? Like go through a list of questions and ask yourself, what am I feeling right now?
I mean, I think it all comes back to tuning inward, right? I think diet culture has taught us to ignore our hunger cues and our satiety cues and just eat because you're either supposed to eat or don't eat because then you're going to gain weight and you should just look a certain way, right? So I think a lot of people really lost that, which is where, you know, just turning more inward, more intuitive eating, more mindful eating, I think is a great place to start. And what we don't know what we don't know.
Yeah.
So if we just turn inward and we're like, what do I really need right now? And you're like, well, actually lunch sucked, you know, like go eat something else that you're going to be satisfied with, even if you just ate lunch, right? If you're like, I feel empty, but I know I just ate. I'd be like, okay, let's, like, obviously you don't want to be overly stuffed, but what will kind of fill that for you?
Yeah, because I find that when you say that to yourself, it's like that guilt of like, but you just ate, you shouldn't
I hear this all the
be
time,
hungry. I mean, I hear it, sorry to put my mom on the spot, but I hear it from my mom a lot. Like, she'll be like, I just ate lunch, I'm starving. I'm like, there's nothing wrong with you. I mean, I could say it to another person all day. It's easier said than done when it's yourself.
Of course,
but yeah, I think it's a really common, like, fear that it's like so scary when you just ate and you're like, why? What's wrong with me? Why am I still starving?
Right. And in that situation, I would really want somebody to pause and be like, but what did you really just eat?
Right.
Did you enjoy it? Was it satisfying?
Yeah.
You know, were you just quickly mindlessly eating because you're in between things? Or did you just quickly eat the healthiest thing because you thought it was the best thing for you to eat?
Right.
You know, and then, you know, it's like, I always hear this too, like people going out to restaurants. You know, with their friends, a group of friends, and like you eat whatever you think you should eat. And then you go home starving. And everyone's like, well, I just spent all this money on dinner. How am I still hungry? Well, because you chose the thing that probably was the least satisfying. And maybe you were in your head the whole time thinking, I shouldn't be eating that. I shouldn't be eating that. So I'm just going to take a few bites and then you're going to go home hungry. You know, like it's like, is it worth it?
How do we cope with the people around us doing things differently than us and talking about diet? I mean, even, and I hear this from my mom a lot, people in menopause and people in that era, I think the disordered eating really gets louder and worse. I know it's like with teens and people in their 20s. And then again, I think it probably never stops.
Yeah. Well, I think it changes with the hormonal fluctuations, right? So like as our bodies are changing, as hormones are doing their job, we're going to feel different things in our body, and there's going to be maybe some weight fluctuation and just going through different phases of your life as well. So I mean, I actually talk about this in the book as well, that like at different phases of your life, you're going to need different things and your body's going to change, and that's okay. It's supposed to change. But then it's like, okay, what do we want to do about it? Right. And I think, you know, the question you were saying before about kind of like how to deal with other people in your life or comments, or, I mean, I would love to say, I'm going to say it, but I know it's hard. Don't compare, right? Like worry about you.
So hard.
Yeah, it's so hard.
Even when someone's sitting next to you ordering something and you're like, oh, so I have to do that. You're like, shit, I wanted this, but I have to get that.
Right. Well, so then what I like to go back to, and it's hard, and I know that, is how are you going to feel when you go home? Right? So I used to use this example a lot with clients who would be like, I feel guilty about asking for the side salad instead of the French fries.
Right.
I'm like, okay, do you think the waiter is going to be annoyed that you asked for the side salad or whatever instead of this? Or are you going to feel guilty when you go home or not feel well because you didn't really eat what you wanted? Right? So at the end of the day, I mean, I would love for everybody to be confident enough to be able to order and to do what they want to do and what's best for them. But that comparison is hard. Yeah. And especially hard in different phases of your life. I think in your 20s, I think when you're dating, I think, you know, for some people when they get older, you know, in different friend groups, as you change in different areas of your life, it can be difficult. Social media makes it very difficult. But if we can pause and go back to the why. Like, why do I really care what they're eating? Right. Like, what is best for me, or what do I really want right now? You know, it's hard, but I think if we can try to do that, we'll all be better off. Right? Because at the end of the day, you are living in your body. Nobody knows what you are feeling and experiencing. or what your body's needs are, just as, nobody would know what I'm experiencing or somebody else.
Right. And it's hard to like on social media, I mean, not just social media, in real life too, seeing how people's bodies are changing and then feeling like I need to keep up. And I hear this from my friends around me. I mean, my friends were aware when I was on medication, and them just being like, oh my God, like, do I need it? And I felt that when other people were on it. So it's like, how do we cope with, and I know it's kind of the same answer, but it's like how it's so hard to cope with the world changing so much and everything around us changing so much, and us, like, how do we stay true to ourselves? How are we supposed to, like, what is self-talk? Like, how can we tell ourselves?
So I mean, I think it's so difficult in today's day and age because as much as GLP-1s are not that accessible to people who need them, they're more accessible in a way more than ever in other ways, right?
They're really easily accessible.
Right. But for people
scary.
Who, right.
How easy.
I mean, I'm sure, and I hear stories. I mean, I've had some.
I don't want to say that, and
but I mean, I've heard some scary stories.
Yeah, it really is.
But I'll put out there again that I have clients that got them from like the wrong places, so to say, and they had horrible side effects. So like, I think just for people listening, like, be very careful and mindful. Like, talk to your healthcare professional if this is something that you're really considering, and see if it's right for you. But because they're so accessible, I think that's what then makes people feel like, well, if she's on it, should I do it, right? Or I want to lose 5 pounds. Like, sure, I'll do that. And again, I think we have to go back to like what's important to us and what's right for us, right? I mean, there's medications that have been out there for years that we know in the healthcare field that also benefit and help people lose weight, right? Like there's certain antidepressants, for instance, that also have a side effect of decreasing appetite and helping people lose weight. So although I'm not a prescribing physician, if I have somebody that maybe wants to lose weight, and has depression, I might be like, talk to your psychiatrist about maybe going on this medication, right? It's like an added benefit in a way that it can kind of help with both. But GLP-1s, for some reason, it's like everybody's like, oh, you're doing it, I want to do it. And the way that I describe it in a way is because celebrities kind of set the trends, right? And if we're seeing celebrities and public figures do these things, it's now resetting the trend, and not like, I think bodies should never be a trend. But unfortunately, it is in a way.
The biggest, I feel like when we look back in history,
it's full circle. Like,
it's full
we're
circle,
back to where we were.
And it's always women's bodies. And it's like just a crazy, but we fall into it every single time because we're living and breathing in the same era.
Because there's a lot of noise. Right? I call it all noise. The messages that we're hearing from the time we were little in our parents' homes to the magazines, which are now is social media and all these things, it is noise. And we are being bombarded with these messages that thinness means this, and that, and you are not worthy unless, but all that's BS. Right? Like, but again, we have to know that. We have to be in a good enough place in terms of our confidence, our emotional health and well-being in order to counter that. It's really hard to challenge our unhelpful thoughts when we're already in a low place.
So what do we do if we're feeling tempted, and how do we know, like, how do you look at yourself and be like, should I be on this, or is this just because I'm being tempted by society? Like, what do you do? What's the next step if you're feeling tempted and you don't know what to do next?
So I think first talking to a healthcare professional, right? If there's, again, if something is distressful, if there's a health concern, if there's an illness, like, it's something to really consider, right? And or maybe building a better relationship with your body and food is a better route first, right? So with a therapist, with a psychologist, something like that. But I think, that's a good place to start. And again, going back to the why. Right? Like, why do I want to go on this medication? Why do I want to lose weight?
Right.
I remember years ago when I worked in the bariatric surgery department, one of the questions I had to ask all my clients was, why do you want to have surgery? And I remember, I think the people that worked with me hated me because if they said to lose weight, I was like, okay, why? Why else? Give me another reason. Like, why else what does that mean to lose weight? Because there's a deeper meaning. it's not about losing weight.
Right.
It could be about not feeling comfortable in your clothes.
Yeah.
It could be about the way that you feel on the beach. It could be so many different reasons.
But is that the same thing then? Is it?
Well, I mean, it's weight is different.
Yeah.
Right?
Because for me, I was always like, oh, I can't fit in my clothes anymore and I'm feeling really uncomfortable and this is distressing to me on a daily basis to the point where I feel like I'm not functioning at my best ability. It's distracting.
Right. So but you just defined something more than just the weight.
Okay.
Right? So like, okay, your weight was causing you to feel uncomfortable in your clothing. Maybe you couldn't find clothing that you felt as good in. That was maybe causing more anxiety and concern in the morning. Maybe you were late to get out the door because you're trying on a million different outfits, whatever it is. And then maybe you're not showing up as your best self because you're in your head thinking my pants are too tight the whole time,
Yeah.
So that kind of spiral, though, takes us to, okay, what's really going on, right? And then what I would say is the first step, in addition to seeking healthcare professional, would be to move towards body neutrality.
Yeah.
Let's get rid of the idea of focusing on our appearance and focusing on what our bodies do for us.
Yeah.
Because if we can start appreciating our bodies for what they do for us, I think we can a little bit get out of our heads about how they look. Yeah. Right? And I think, at least for me, I remember so I'm a runner, but the first time I ran a full marathon, and then again when I did a triathlon, actually, I remember 2 times in my life. Yeah. 3 times in my life, I'm going to say, because then when I had kids. But 3 times, all right, I'm going to add another one because I have 2 kids. 4 times in my life, I have been like, wow, my body is incredible. And those are just high points. Yeah. Because really, I think of that all the time.
Yeah.
Every time I go on a run, I'm like, wow, my body is capable of doing this. Yeah. Actually, as much as I run throughout the year, on my birthday, every year, I run as a gift to myself.
I love that.
And it is literally like, wow, I am capable of doing this. Yeah. And then having kids again, I was like, wow, my body birthed these children, right? Breastfeeding, I had the same thought. And I think if we can start, and you don't need to have a baby to go through these kind of moments of realizing what our bodies do for us. But I think if all of us can just appreciate our bodies for what they're doing for us, we're able to move a little bit past that appearance into more body appreciation. Yeah. Right? It doesn't need to be body acceptance if you're not there yet. I actually say we're all on a journey of body acceptance. Totally. We don't just wake up and we're like, I accept my body. Yeah. We also don't just wake up and love our body one day. Right. But we can appreciate it for what it does. Yeah. So an example would be I always say I love my arms because I can hug my children. I love my legs because they got me here today. Yeah. If we can just identify one of those things and start reminding ourselves of something our bodies do for us every day, we start to slowly replace those unhelpful kind of hate, harmful, harsh thoughts with the more appreciative, kinder, more compassionate thoughts. Yeah. And in time, it actually makes a really big difference. Yeah. And again, thoughts impact emotions and impact behaviors.
Right. I do think working out for me has been really helpful in actually grounding myself in body neutrality because when I was younger, I struggled with feeling like a workout was a punishment. Now, my workout is my treat. That is my 1 hour of the morning where I'm on Do Not Disturb. No one can bother me. And I feel the most present. I feel every single part of my body. And that's been a beautiful journey for me, I feel like. And it makes me appreciate my body more.
Yeah, I love hearing that. Yeah. And I try to encourage my clients to move their bodies in some way, whatever feels good to them for that reason. Because actually there's research that shows that individuals who move their bodies, work out, exercise, we can call it whatever we want, actually have improved body image. Wow. So, and the reason is for that reason. First of all, I mean, our endorphins, everything's, going. But we start realizing wow, my body can do this.
It's crazy.
Right. I mean, our bodies are fully capable of doing whatever your body is capable of doing. Not everybody can do everything. But it's a great kind of hack for body image actually, is to just get moving.
Yeah. Do you have any other body image hacks or things that can kickstart someone who's feeling down and just wants to start feeling like themselves again?
Yeah. So, I have this in the book as well, but in psychology, we call it behavioral activation. So the part of CBT is that we can tweak our thoughts and work on the cognitive level first, or we can tweak our behaviors and work on the behavioral level first. Regardless of which one we do, it's going to impact all of them. For some people, for many of us at different times of our life, we're not ready to do the thing.
Right.
Thoughts wise. Like, oh, I need to, the common thoughts I hear is I have to lose X amount of weight before I can go on the beach and wear the bathing suit. I have to lose X amount of weight to go on the date. I have to lose X amount of weight to get to the gym.
Yeah.
Well, that time may or may not ever come. So just do it. Like literally, I have this in the book, like the Nike slogan, got it right. It is behavioral activation in disguise. Sometimes you need to just do it.
Yeah.
When you don't feel fully ready or you don't really want to do it and the thoughts are what's keeping you exactly where you are, we need to be like, that's just a thought.
Yeah.
That's not fact and I'm just going to do it. Because if we overthink it, we're never going to do it.
Right.
So like if you're in a body image slump, like just get dressed, right? It doesn't need to be the whatever outfit, maybe you're not feeling great in a lot of clothes, whatever outfit feels great on you, like find the clothes that you feel good in, put it on, and it's going to immediately change the way you feel about yourself, your thoughts, how you show up in the world.
Yeah.
But if you put on tight clothes, you're going to be thinking about it the whole time.
Right.
Right? Or just get moving, right? You're not ready, but you know what? Just get the walking shoes, go out the door, walk a little, almost guaranteed you're going to start feeling better.
Yeah. Which is why I kind of stopped looking in the mirror as much, which is crazy because a lot of people are like, go hype yourself up in the mirror. But for me,
it doesn't work for everybody.
It doesn't. Like, and for someone that it does work for, amazing. Right. I just found that like that then brought the theme back to appearance. Like you look amazing. And it's like, instead of that, just getting out the door and like distracting myself with other things in life was the thing that actually I feel like helped me get out of that.
I like that you shared that because it kind of brings up toxic positivity.
Yeah.
So like if you're going to hype yourself up in the mirror and it feels good and it feels genuine and it motivates you, go for it.
Yeah.
But if you're like, you are amazing, you are beautiful, and you don't believe it, it's actually not going to work. You're setting yourself up for failure.
Yeah.
So, again, we have to meet ourselves exactly where we are.
Right.
And maybe it's like, I don't feel amazing today and I'm doing the best I can.
Yeah.
And I'm going to go for a walk and see how I feel.
Yeah. I want to shift gears to your book.
Yeah.
Because we're talking about these kind of like statements and you talk about that in your book. So can we shift gears to on a more general sense? If you're going through life and you're just feeling meh and you're feeling like, I mean, I'm struggling with this currently, like the way you talk to yourself is not helping you show up as your best self. What are some of those reframes? Like what are some of those like ways that you can talk to yourself that are better than the negative ways without it being toxic positivity?
Yeah. Yeah. So first, I mean, if it's not working for you, we've got to change it.
Yeah.
Right?
Yeah.
And I use the word tweak throughout the book because change is really overwhelming.
It is.
Tweak is like baby step. Like, what's the teeniest little change we can make or tweak? So it's not helpful for most people to do the complete opposite with that self-talk. So like if you have a negative, unhelpful statement of like, I don't know, I hate my body or I'm never going to get this job or I'm never going to find this partner. You don't want to say the complete opposite.
That's interesting because that's what I like try to do.
Yeah. Well, again.
But it doesn't work. It doesn't work right away.
So if it doesn't work, don't do it.
Yeah.
But if it motivates you, do it.
Okay.
Like there is science to positive psychology. It's a field of study. There is research backed. There is science to it.
Yeah.
I like to think of it more so as there's a hopeful, healthy optimism versus toxic positivity. Toxic positivity is one extreme that's really dismissing all other feelings and emotions. We are humans with a wide range of emotions. We should not be happy all the time. That's just not real life.
Yeah.
Like we don't live in a bubble. Reality is that life can suck sometimes. And that's okay.
Yeah.
It's what we do with that.
Right.
So if the complete opposite statement isn't helpful to you or motivating or encouraging and setting you up for failure, then we have to tweak it. Right. So again, do we know that you're going to find the partner or get the job or whatever? No, we can't predict the future either. But we can say, I'm trying my best. Right. So saying like, I'm never going to get this just feels negative. Right. Like if you have that thought, you're going to feel probably discouraged and unmotivated.
Yeah.
That again is going to lead to a behavior.
Right.
If you're like, I got this, and then you don't get the job, that's going to suck.
Yeah.
But if you're like, you know what? I'm prepared. I'm a good candidate. I did examine the evidence.
Yeah.
It's a tool actually in CBT.
Yeah.
Examine the evidence. Is that statement true? Are you sure that you're never going to get the job? Where's the fact?
Right.
No fact, no evidence. Okay, where's the fact you're going to get it? I don't really know. But the evidence is I'm trying my best. I'm doing this. I'm doing that. So a more hopeful reframe would be I don't know and I'm trying my best.
So what if you struggle with feeling confident at work, for example, like I'm not good at this, and you really truly feel that, like that is your truth. Then what do you do? But you want to feel better. I guess I would assume that someone that shows up like that, like you want to feel better, but you're talking to yourself like that and that's what you believe.
Right. So first I would ask, is it a fact? Right? Is there evidence?
Is there
like maybe you had a bad review. Maybe your boss said something to you. Okay. There could be evidence. And then another basic CBT tool is problem solving.
Yeah.
Like, all right, how can we change this?
Yeah.
What can we do differently, right? So another thing going back to a mindset with that is I never like to tell my clients to think of like what you should have, could have, would have done. But next time this happens, what can you do differently?
Right.
And that sets you up with a growth mindset.
Yes.
It sets you up with doing better and not setting you up for failure,
Yeah.
right? If we do what I should have, could have, would have done last time before I had that review, I'm not going back in time. Like that's out of our control.
Right.
But all right, with the information I now have, what can I do differently?
Yeah.
Right? So I think, and in that situation too, I mean, maybe examining the evidence, maybe you have to go to your boss and be like, hey, I haven't been feeling really confident about work lately. You know, how was this project? How did I do? Ask for feedback.
Yeah.
Right? Or ask, how can I do better? Right? Like I'm feeling like I'm not giving it my all. Is there something I can do differently?
Yeah.
Right? And then also confidence is built. I think a lot of people forget this or don't realize it. We don't just wake up feeling confident.
Right. Which I think people have the idea that you're either born confident or you're not.
Exactly. It's not something we're born with or we're not. It's something that we build.
Yeah.
And each thing we do and we feel a sense of accomplishment, that's confidence. Right? It's like, oh, I did it.
Yeah.
A little step up on the ladder.
Yeah.
Right? Then we do it again. And then we do it again.
Yeah.
And then all of a sudden we're confident in doing it because if we examine the evidence that we're going to screw up, there's all these successes that we didn't screw up.
Yeah.
Right? But if you do it once and you screw up, your brain is going to tell you you're going to screw up again.
Right.
Because that's all it knows.
Right.
And then you're going to stay stuck in that cycle and never try again. But as I say in the book, like that's where procrastination comes in. That's where giving up before we even get started comes in. It all starts with the mindset.
So it's like, what are tiny baby things you can do if you don't feel confident in yourself or you feel like you're lost your confidence to build it back up again?
Yeah. So you can think of the teeniest little thing. So I'll just use an example of like a speaking engagement, right? So like if you're like, well, I really screwed up that speaking engagement. I'm nervous to do another big one. So do a little one.
Yeah.
Right? Or having a really difficult conversation with a friend. First have a similar conversation in like a safer, lower stakes situation to build that confidence. It's really exposure therapy is what it is. It's like starting low in a really anxiety provoking situation, building it up and feeling more confident and comfortable. And then your brain knows, well, I've done this before.
Yes.
And if you've never done it before, another tool in the book is visualization. Actually using imagery or visualization, you can train your brain in a way that thinks you already did it because you're using all your senses. Your brain's going to think you did it. And that's going to be like, check, I already know how to do this. I've done it before. Even if you didn't actually do it, mentally you did it.
So it's like you're literally picturing yourself
doing
like before you go to bed at night, you can kind of like picture yourself. I used to do this when I was in gymnastics. Like
I was going to say athletes do it a lot.
Yeah. I know. So it's like, it reminds me of that. Like before gymnastics meets, every night my dad would have me visualize my routine.
Yep.
And it works.
It works.
Yeah.
Because you wired the brain to be like, oh, I know what to expect.
Yeah.
Right? It's why like athletes visualize what they're going to do and how the game is going to play out if it's a game or running or whatever it is or gymnastics. Because then the brain is comfortable. It's familiar. It's like, I've been here before. If the brain thinks it's never been there, it is so uncomfortable, so anxiety provoking, so overwhelming. And your brain's going to jump to, you can't do this.
So just to bring it full circle, can you do this with body image and when you're struggling with your body?
Yeah. I mean, why not? Right? We can retrain our brain to think differently, but it takes practice and being consistent.
That like gives me chills, honestly, because it's something that feels familiar in other areas of my life. But I think putting that in practice when it comes to your body can be really, really impactful.
Yeah.
So that's actually something I'm going to take with me
Yeah.
to try at night to visualize myself feeling better in my body.
Yeah. And I love that you said that, because I was just about to say it's not about visualizing your body looking different.
No. Yeah.
Right. So I'm so glad you said that. It's about visualizing
Feeling.
the way you're feeling
Yes.
in your body.
Yes.
And again, the mind-body connection, like how am I feeling right now? And yeah, like use that, right?
Yeah.
Again, things are learned because of culture and society.
Yeah.
We can unlearn and relearn.
Mm-hmm. I love that. Thank you so much for this conversation.
Thank you.
It felt very cathartic for me. I'm sure everyone else felt that way. Since the theme of the podcast is someone being able to take action today, what is one thing, and obviously you have to plug your book, what is a couple things or one thing that someone can do to take action if they're struggling with anything?
Yeah. So I'm going to say to pause and to check in with yourself, right? Like no matter what you're going through, just kind of slow down, pause, and ask yourself a few questions like, how am I really feeling? What do I need right now? What's working? What's not working? It doesn't need to be all 4 questions, but whichever one resonated.
Yeah.
Because if we can start tuning more inward, we're going to actually start feeling more confident also and believing in ourselves in a way that you can show up as the best you. But if we're just going in autopilot, we're going to miss so much. So I think that would be the main one. And then, of course, buy my book because all the tools that we talked about and more is in the book as well.
Yeah. And I was lucky enough to get a digital copy and I went through the entire thing. There's just so much information packed in there, but it's at a level that I feel like anyone can understand. It's very approachable. And I'm very excited for people to read it because I think it will be extremely life-changing for people.
I hope so.
It will.
So
it absolutely will. And tell everyone where they can find you on social media as well.
Yeah. So I'm at Dr. Rachel NYC across most social media platforms. I always like to remind people, like we said here, this is not therapy. Social media is not therapy, but I love connecting with people. So send me a message. I'll either point you in the right direction if it's a resource, a referral, or just to say hi. But yeah, I love connecting with people.
Amazing. Thank you so much. And thank you guys. If you haven't already, be sure to subscribe to the podcast and we will see you in the next episode. Bye.